So we don't have a national healthcare system. We have 13 healthcare systems, all of which are different in nuance and culture. Complexity can't be an excuse for inaction. We could have a discussion at the Queen's Conference about what should we measure and why, and then have a deliberate action plan coming out of it so that those indicators can be used across the array of healthcare consumers of health information, policymakers, funders, clinicians, and the public. That's how change happens. One of the things that I'm looking forward to the most is that while we can talk about these policy challenges, it's going to be in an apolitical environment. The sorts of discussions that we're going to have with policymakers at the conference allow for a much more rich discussion of these sorts of issues.
Measuring the success of a Canadian healthcare system is going to be a very difficult and interesting discussion that will happen at this conference. Less is more. A few measures that are meaningful, they're outcome-based, they have high impact, could potentially help align all the different stakeholders across the system. When you look at any great changes that have happened in the world, they've all started with ambition. So bringing together all of these stakeholders, as Queen's has done, to imagine a future, a shared vision of what is possible, and then to step back from that and think about what are the key strategies to advance that vision. How can we align incentives? And how can we create this tipping point of change? And courageous leadership is going to be required, and Queen's has brought together some incredible leaders from across this country and around the world. And as I reflect on the two conferences I've been part of, leadership has been one of the most important themes in terms of driving change and system improvement. And we need really bold leaders from private sector, from government, to get behind this and keep it front and center. The Queen's Health Policy Change Conference is really important to this country because it is asking a very difficult question around the Canadian healthcare strategy. What could this do to improve healthcare for Canadians?